Now, let's talk about the severity of hearing loss and resulting impairments, in which is the severity or degree of the hearing loss corresponds to losses and decibels that result to learning difficulties. Degree of hearing loss. The first one is the normal. Its equivalent to decibel loss is 0 to 20 dB. Hearing impairments of normal is none. Next slide, decibel loss 27 to 40 dB. Hearing impairment is faint sounds and distant conversations are difficult to hear. With a hearing aid, the students can attend regular school. The third one is mild, 41 to 55 dB. Its impairment as much as 50% of classroom conversations are missed. Limited vocabulary and speech difficult may result. Moderate, 56 to 70 dB. Loud conversations can be heard. Defective speech, language difficulties, and limited vocabulary may result. Next one is severe. Its decibel loss is 71 to 19 dB. Hearing is limited to a radius of 1 foot, enough to discriminate loud sounds. Defective speech and language and severe difficulty in hearing consonant sounds may result. The last one is profound, 91 to above. Sounds and tones cannot be perceived. Vision becomes the primary sense of communication. Speech and language are likely to deteriorate. Etiology of hearing impairment. Hearing impairments are attributed to genetic and hereditary factors, infections, environments, and other traumatic factors. Some hearing impairments have unknown causes. Genetic and hereditary types of deafness occur in 1 out of 1,000 live births. Causes are hereditary and chromosomal abnormalities. Infections such as maternal rubella, cytomegalovirus, hepatitis B virus, syphilis, mumps, and otitis media may occur during pregnancy or after birth. The last one is adventitious hearing loss. It can be attributed to environmental factors such as excessive and constant exposure to very loud noises. So the traumatic factors can cause hearing impairment at birth. Low birth weight, difficult and prolonged labor can traumatize the hearing mechanism and cause hearing loss and permanent damage to the ear. Common disorders associated with hearing loss. Atresia, absence of the external ear canal, usually unilateral or found in both ears, often seen in conjunction with such syndromes as Crozon's, Stitcher's, Collins, P. usually congenital but can be acquired, results in conductive hearing loss. Acoustic neuroma, benign slow-growing tumor associated with NF2, chromosome 22, autosomal dominant, and others. The third one is the firstola, and here is the description. Autoimmune disease. It is associated with a variety of immune disorders such as HIV and AIDS and many more. Ototoxicity can be caused by a wide variety of strong antibiotics such as aminoglycosides, gentamicin, chemicin, and others, can result from exposure to our virus chemical agents characterized by a progressive high frequency. Cytomegalovirus or CMV, so most common congenital viral infection causing hearing loss today, occurring in contracted during pregnancy, during or after birth, can result in sensorineural hearing loss as well as CNS, cardiac, optic, and growth abnormalities, and more. Meningitis. Neonatal infection can be viral or bacterial. Most common cause of acquired sensorineural hearing loss. Hearing loss can range from mild to profound and may be progressive. Symptoms may include headache, neck stiffness, photophobia, and suppurative otitis media. Down syndrome, congenital chromosomal abnormality trisomy 21, 30% of these children had sensorineural hearing loss, and more. Cholesteatoma may be acquired or congenital, a benign growth of slow-growing skin tissue in the middle ear, and many more. Curzon syndrome, congenital abnormality of the external middle ear, inherited autosomal dominant disorder, Prague face appearance. 1/3 of these children have bilateral conductive hearing loss, and more. Waardenburg syndrome, autosomal hereditary dominant disorder, 20% have white look for lack, 99 for increased distance between eyes, 45 for races of different colors, and more. Usher syndrome, autosomal recessive disorder, occurs in 6 to 12% of congenitally deaf children and 3 in 100,000 of the general population, and more.